The Zoll R Series is an invaluable life-saving tool. At Trinity Health Livonia, it can be found on crash carts throughout the hospital. It can be utilized as an external monitor, a defibrillator, a pacemaker, a vital signs machine, an AED, and a CPR feedback device. In this video, we will focus on the defibrillator, AED, and CPR feedback aspects of the Zoll R Series from the perspective of a BLS-trained provider initiating a code blue on a patient. You, a BLS-certified healthcare provider, are conversing with your patient when they become unresponsive. You feel for a pulse for 5 to 10 seconds and feel nothing. Acting quickly, you activate a code blue by pressing the blue button on the wall and immediately begin CPR. Very quickly, another BLS-trained colleague arrives with the crash cart and Zoll in tow. They move the Zoll onto the bed. You pause CPR and apply the pads and backboard. Proper pad placement is key to give a patient the best chance of survival. The pads should already be connected to the Zoll while it's stored in the crash cart, but if they aren't, you'll need to connect the pads to the Zoll. Align the connectors from the pads and the Zoll so that the two large sections will meet. Push them together, and the lock tab on the top of the connectors should snap into place. Open the pad package. Notice that the pads are numbered, and there are pictures to guide placement. The rectangular back pad has the number 1 on it, and this should be placed first. Roll the patient onto their side and position the pad on the left side of the spine, just below the scapula. While the patient is rolled, also place the backboard under the patient. It can be found on the back of the crash cart. Then, roll the patient back onto their back. Placement for the front triangular pad, labeled as number 2, is a bit more specific. Ignore the triangle. Focus on that oval. The red cross should be aligned vertically with the middle of the sternum, and horizontally at what is depicted on the pad as nipple level. But if your patient's nipple location isn't as finite as our friends here, more specifically, this should be at the 4th intercostal space. The picture also shows that if the patient's breasts obstruct placement, to lift the breast and position the pad beneath. The oval that you just placed will be where you compress during CPR. With the pads and backboard placed, turn on the Zoll by turning the large control knob to the red defibrillator position. If you're coding a patient, they're currently dead, so if they're dead, flip straight to red. The defib section is also numbered. 1 was turning the knob to defib. 2 is to press either analyze or charge. As a BLS certified provider, you are not trained to identify a shockable rhythm. But the Zoll is. When a rhythm shows on the screen, immediately press Analyze. This will essentially put the Zoll into an AED mode, where it will analyze, direct shocks and CPR, and run a CPR timer. If the patient is currently in a shockable rhythm, the Zoll will automatically charge. When it is charged, the orange shock button, labeled as number 3, will illuminate. The Zoll will announce, "Press shock." Loudly yell, "Clear! Everybody clear!" Look around. Ensure no one is touching the patient or the bed, and then press the shock button. The standard joule settings are 120 for the first shock, 150 for the second, and 200 for all shocks after. They will increase automatically following each shock, but energy can be adjusted if directed by an ACLS level provider using the Energy Select arrows. If the rhythm is not shockable, the Zoll will announce, "No shock advised. Perform CPR." Either directly following a shock or a no shock advised, another BLS provider should immediately resume compressions. They'll be compressing on top of that oval pad that you placed on the patient's chest. The Zoll is now able to provide CPR feedback that you can see in the purple section at the top of the screen. It tells you the depth of every compression in real time. If your depth is less than 2 inches or more than 2.4 inches with a compression, the number will light up yellow. If you are not pushing at least 2 inches, you will also hear an audible correction. Push harder. If you correct your depth, the Zoll will then tell you, "Good compression." Listen for that feedback, especially if you can't see the screen. The rate is shown as well, aiming for 100 to 120 compressions per minute. If you're outside of that, the number will light yellow, and you will hear a constant beeping metronome. That beeping is coming at 110 beats per minute. Compress to that beat. If you do, you'll achieve the proper rate, and the beeping will stop. Good job. The release bar signifies the recoil. It should be filled fully purple between compressions, indicating full recoil. The PPI is the perfusion performance indicator. If that diamond is full, it means you're achieving ideal perfusion for the patient. This takes into account the depth, rate, release, as well as time off the chest, which you'll have when you pause for breaths and while you're analyzing rhythms. Always aim to keep pauses in CPR to 5 seconds or less. This lets you fill that diamond, and keeping that diamond filled means you're giving your patient the best chance of survival. In the bottom corner, you'll notice a small CPR timer. As soon as you shocked, this 2-minute countdown started, and at 2 minutes, the Zoll will direct you to
press analyze
and continue prompts associated with the patient's rhythm. Continue with this 2-minute cycle of CPR and rhythm checks until the code team arrives. As stated, the Zoll has many other functions. But if you are coding a patient and you are BLS certified and do not have ACLS certification, you are expected to, and certified to, apply pads. Use the CPR feedback to provide quality CPR, and use the Zoll to analyze rhythms and shock patients based on those results. Do not take these responsibilities lightly. Quality, timely response is the difference between life and death.